Hi, it's Dr. Brower, and I'm going to talk to you today a little bit about PRF, sinus complications, and how to deal with them. If you look at the x-ray here, we removed this first molar here, and you can see there's large caries on that. And there was some inflammation in the sinus related to it with the roots being into the sinus. You can see there's no buccal plate present at all. So that's kind of a complex problem. I was considering using a larger diameter implant like a 9x9. Without any buccal plate, I'd have to engage the mesiodistal walls. And I took the pilot drill that's the same size to see, and I found I was just too close to the molar, so I couldn't do it. So initially, there's a little septum of bone, and it wasn't wide enough or deep enough that I could, osteodensify it and make it big enough to hold a smaller implant. I was concerned I would lose it into the sinus. Plus, with the inflammation, I was a little worried. So what I did is I took an osteotome and broke that off and used it as an autograft up inside the sinus. But at the same time, the perforation from the lingual root showed up, and I decided that I didn't want to try and place today. I wanted to just graft. So what I've done is taken some blood and made some artificial skin that we're going to use. Just our regular fibrin PRF. And I grab this little piece up. And we're going to make these little membranes just like this. So this fibrin is really nice for repairs, and it's really nice for closures. So after I do them, I typically like to kind of lay them out to dry a little bit so they get a little stickier. And I'm just going to lay those there. What I like to do is put one at the base directly and kind of making like a cup out of it if I can, and a bigger one if possible. So I'm going to take that and place that in there right now. Go ahead and open for me. And you can zoom in. Not sure if you can see this angle, but there's a little perforation there on the lingual. And so I'm going to place this in, and I'm going to fold it and just compress. Okay, just like so. So I'm going to do one layer and do two layers, taking the smaller piece here. Now, I have a little technique where I use the red caps and make the injectable PRF for sticky bone. So I took a 50-50 mix of cadaver regular alloderm graft, and then I also got a bovine mix in here. So I'm going to go around the outside, and you're going to see that this comes apart like a big piece of jello. So it'll of course take the shape of anything I want. So that's actually my graft right there. So I'm going to take this, and you really can't overpack because you have plenty of room in between the cells. So now I'm going to pack that in there. And again, we are looking to get some height in the sinus too. So I'm going to initially pack it, and then I want something that's fairly flat. Anything will work really. So I'm just taking an osteotome that I used earlier, just to kind of push. And by making this sticky bone, it's not going to go up into the ostium and just travel all over. So I've got my 2 layers of PRF to hold it in there. And then I'm filling. You can see it's getting pretty hard to compress, which is exactly what we want. Just like so. And then I'm going to relieve the tissue. Yeah, if you need to section there, go ahead. Just making sure I can get my PRF underneath it. So this is loose here. So, coming back. Just going to take the PRF, tuck it under the buccal. Tuck it under the lingual. And I like the fibrin for this just because it is so tough and resilient. And I always like to use 2 layers for everything if I can. Okay. And then I like a long resorbing monofilament. So I'm going to go ahead and use that. initially going to come over the top, not through the PRF. Come through, leaving that loose, coming back. Counter pressure. Same thing. Going back. Okay, I'm gonna have my other assistant come over here and retract for me. Just hold that right there. Move your hand back for me. Up here. Thanks. I'm gonna grab my tail, kind of hold it out in the air, and you can see I've got a nice little cross stitch. And I don't want my tension on the margins, so I'm using it just broadly across the top. Okay, hand me a little piece of gauze, please. And just gonna pat it down. So you can see it looks just like skin, and that's exactly how I use it. So this is how I get my primary closure with sticky bone. So now that I've done that, I'm going to do an internal suture where I start inside the PRF, come through, and this is going to lock that PRF inside, push down, come through, keeping away from the margins again. I want those margins loose, so there's no pressure necrosis from your flap design. Excellent. I have a really nice patient here. She used to be an instructor, so she knows what it's like to hold still and have everybody do just what we want. Okay. So again, starting inside, coming right out between my two stitches. That's the goal. Again, coming inside, right between the two. Okay. I'm going to pat that down one more time just so everybody can get a nice look at it. And let's see if we can get a kind of direct on. Can you tip your head back a pinch for me? Perfect. So we did place an implant up here into a previously performed graft. You can see I pushed this buccal tissue forward a little bit because it's nice and keratinized. So the abutment itself is going to thicken that tissue. Okay, well I hope that's helpful. Thank you very much.